No, it's not. Stop.
You're right.
Based on that, it was a DIA.
Call to order for the meeting today. Thank you, everyone. I do want to announce that Rosemary Hall will be a little late joining us, and I will start the meeting, and then she can take over when she arrives. So just a couple announcements. The first announcement is our Delaware County Health Department Director, Melissa Line, has departed. And we are currently looking for the replacement for the DCHD director. And Laura is the interim DCHD director. Thank you for stepping in to be the interim. Also, we had an executive session meeting last week. And I don't think there's any more announcements at this time. I want to open up for any public comment on the agenda items at this time. I don't see anything about any comments. So let's review the minutes from last meeting. I'm going to open up for any comments on the meetings from the last meeting. Any concerns, comments, questions? Motion to approve.
Second.
We have approval from two of our board, so the minutes are approved. And Laura, would you, as the interim director, can you provide updates?
Just have a few. One of them is related to the strategic plan for the Board of Health. Just a couple of screenshots of that right now. We also have hard copies in front of you guys before. This is something, a process that we started last fall with a consultant that worked with the Board of Health for some strategic plan retreats. And we identified 4 priority areas for the long-term plan. I think at one point, I think that isn't firmly established yet, is whether this is a 3 or 5-year plan. It's something that the board might want to discuss internally. But there are these 4 major priority areas, and we've fleshed out individual strategies to achieve each of the priority areas in the document they have for them. So there'll be strategy, the implementation steps to achieve the strategy, what timing we've suggested could go along with that, and then response. So just how can we operationalize these important priorities? The first one was enhanced communication. Oops, that was the wrong direction. Okay. The second one, priority B, was greater use of data. Priority C was the 21st century public health model. Priority D was the community health improvement plan shift that we're recommending. Look forward to the board's input into this and further discussions to refine this. Moving forward. Comments or questions upon this? The other item, which is being driven to us right now as we speak, is your own copies of calling it an annual report, but really it reflects the 2 years of operation of our department. So I'll make sure you have that before you leave, and it's something we'll be doing a press release on the next week or so. I believe, I mean, it might be 2 weeks, and then we'll be doing a distribution to partners. But it really helps us kind of share with Delaware County and our stakeholder agencies and partners. What, you have this new health department. What were we able to give you? Like, what have we built? Where are we? And so it's meant to be a really visual piece that can help people digest where we are, what we're doing, and who we are. So
That's great. Yeah, that's great. Looking forward to reviewing it.
I can give you my copy now, and we'll get the other ones as they come. So those were the 2 items that I had under my portion. So we can move on to business. Yeah. Where do we do the comments on the consolidated report? Usually also in my director update report.
Is that the status report?
Yeah, the consolidated report that.
Yeah, I think that's part of the director's update.
Okay, so now's the time to say, do you have any questions about it? Okay.
And I just want to ask you about the grants and the balances on the grants. I'm sure there's not a single answer to that because there are, a bunch of grants, but each of them has a balance. Some of them are substantial, and I just wonder, do those balances have to be remitted back to the funding source at this point, or do they roll over?
It's very grant specific, you're right.
Yeah.
Some of them will have portions that we can roll over, some emphatically do not, and they will tell us that. So it definitely does depend. Some of them are multi-year arrangements, so. I don't know if there was one particular that struck your.
No, I was just struck that each of them, and I was just wondering, I realize there's the run rate isn't even across the period of the grant necessarily, and you may get to the end of the funding period and have a balance, but just curious as to, if you could pick one, why there's a balance.
Well, I know for one that we have a very large immunological laboratory capacity grant. I've seen a pretty big balance on that one, and we have not been able to invoice the state. I think it says last July. And it's basically a processing issue with the state. They're working through the logistics behind all that. So we've been keeping records. We have invoices ready to go, but we've been holding them.
So eventually they'll accept the invoices.
Stephanie has a thought.
And I get a little baffled by our grants too, with specifically with immunizations. We are very limited with what we can do with a lot of the grant money. It's like we can't buy vaccines with them. A lot of the, I'll say marketing stuff has to get approved. So there's a lot of red tape even just to use the grant monies, particularly in personal health, so it has to go through approval processes. Sometimes it's denied, but the biggest ticket item that we would like to be able to use them for, we can't. We're trying to the actual vaccines, so that's where you see a lot of balances, at least within the immunization grant, HIV. Title V, we're good with. That's a smaller one.
Is that a Commonwealth grant, Stephanie?
Yes, it is.
And is that prohibition imposed by the General Assembly, or what? Why is it?
Isn't that federal that they can't use?
So the HIV is
Passed through from the.
Yeah, HIV definitely is federal, but I think immunization is.
I thought that everybody had that problem across the state country, but I don't know that for sure.
I don't know for sure either. But so that will explain a lot of the balances for our division.
Can I just ask a question about the West Nile?
Sure.
One thing.
Environmental here today.
Okay, good. I'm not sure whether to think these are a lot of pools, positive pools, or not. Is this a year that's out of the ordinary?
So we meet with DEP monthly and they go through all this with us, and all throughout the season, they've basically showed us over the last 5 years that we're trending down. So we'll see we saw a lot less positive pools this year, a lot less mosquitoes in the surveillance traps that we were keeping all throughout the county. So we're trending down. Yeah.
We only had one case in the county.
Positive human case?
A human case.
No, we've actually had just recently a few came in. Maybe Victor, can you help me out with that one?
Yes,
Just recently, I think.
and between Delaware, Montgomery, Philadelphia counties, less than 5, 2 for Delaware County. The rest for the other ones as of September 10 of this year.
Some of the reduction in detections in the pools and things is incredibly dry second half of this summer. We would say that is part of it. I mean,
Yeah, it's pretty typical. You'll see it goes in ebbs and flows. And it's pretty much, I've seen it just in my own experience over the last 8 years. I was around when it was at its peak and the season lasted pretty long. Like as of right now, because we're trending down, we've stopped, tick collection, surveillance has already been is going to end on the 27th, which I think last year we went into October.
Mosquito pools.
Yeah. So we'll stop all of that testing. And I can touch on the grants too. As far as the MDC grant, we've run January to December. So the majority of our invoices are going to fall between May and October. So we should spend a good chunk of the money when we invoice this next quarter. We still might have a little bit left over just because of some other logistical stuff early on, but we should spend the majority of that, in this next quarter.
Thanks.
Actually, a question about the vaccines. Are we, what type of vaccines are we giving out? I know the pediatrics vaccine for children vaccines. What about the flu vaccination for adults or pediatrics? So is that something you guys are working on?
Yeah, so we're getting, for pediatrics, the vaccine, the flu and COVID. We've also bought some, private stock of flu, COVID, Shingrix,
RSV.
yes.
Private stock RSV though, that's just for.
No, I'm sorry. Yeah, no RSV. We did, Prevnar 20. We did a few for a homebound program. But we will cover all the pediatric, vaccines and just, we have a few, some things for our flu drive-throughs, some COVID available. And we're working on a few other things for adults. So,
And we've talked about the majority of our vaccination efforts at the health department are going to be for folks that are uninsured or don't have other access to vaccines. But we do have a limited private stock for general community vaccination efforts. And we will be doing, we haven't set the dates yet, but there will be some community flu drive-throughs that, as we've done in previous years, that will use that private stock for.
and they'll be able to walk in here for those too.
Yeah,
Whatever. So we, after the drive-throughs, they'll have opportunities to do walk-ins through our, clinic here to get the flu shot as well through the season.
I'm curious, you said only for the uninsured. Oh, I'm so sorry to interrupt. You mentioned the uninsured. So when they walk in, you ask them for their insurance coverage and then.
So we only have to do that, a check for VFC, but we're not checking for insurance for adults that walk in.
If someone comes in for a walk-in flu, we're like,
Yeah.
you know.
Yeah. So it's just for anyone that's interested in it.
Okay. Have you also given out HPV vaccines?
We are, absolutely, yes, absolutely. We're actually running a campaign too with it, where we have, in our dental kits, we, giving some brochure information in our dental kits as kids come in. Anyone that comes in, they're eligible to receive the dental kit with the HPV information and get the HPV vaccine.
Have there been any resistance to,
I'm sorry.
any resistance to HPV vaccine?
Actually, no. So we had a nurse, she recently left, however, Kalika was her name. She did a great job educating parents about it, which, I thought we were getting a good response to it at that point. But right now, we haven't had one. It's really about the education on that.
Questions?
Thank you. I guess we're going to old business and the next thing on the item is Achieve It demo.
Yes, so it's when Sean's gonna give me a chance to share my screen. So we've been talking about how to be a 21st century public health department, we want to do the best we can with performance management and really use one of the more extensive, we researched a lot and looked for a system that was going to allow us as a department to track strategically what are our goals and how we're doing to achieve them, and make that just really visible both for ourselves and hopefully eventually even publicly. But we just launched this Achieve It system in July. So as for your patience, as that even I have trouble like navigating around it, I'll do my best. What is that? Oh, Rose. We just started the Achieve It demo, so it's all demo. This is what a dashboard, for example, looks like in Achieve It, but I'll go back a step. This is their list view. So there's a lot of data underneath this, and if you look, whoops, no, this is I don't want to show that one yet. All right, I told you I was gonna have trouble. I'm gonna do the tree view because I feel like visually that really helps give a picture of what we're talking about. So if you guys remember, we are required as a department in the Commonwealth to submit our program plan to the state of Pennsylvania every year. It's an annual plan and it's got requirements to it by division that we need to achieve. So we decided one way we could start using this performance management system was to put our program plan into it. So that's what this is. And you can see by division, administrative, personal, environmental, pop health, epidemiology. And each one of these cards is built out with all the elements of that program plan. And you just keep going deeper and deeper. what do we need to do in administration program division? We need to ensure that all programs required are operational. And then underneath that, but how are we gonna do that? We're gonna do reporting every week. We're gonna make sure, we're gonna stabilize our staffing levels. And then when possible, we're gonna embed in each one of those measures a metric. And this is something, again, we're still really building out. But this is an example of an easier metric. In our pop health division, we had one, that we were gonna have at least one program that promote whole person care and prevent mental health. We did, so that shows that, yeah, great, we've achieved that, we did the one program. So we're gonna make things harder and harder for ourselves going on, but here's one, for example, in Epi, and I'm picking happy stories right now, I can show you ones where we haven't really started yet, but for Epi, Victor had set a goal, participation in child and fetal death review boards for the county, at least 4 over the year. Looks like you've already done 4.5, I'm not sure what the half meeting meant, but Victor, you probably do.
Almost there.
Oh, is it?
More meetings, more review, very, very exciting process of reviewing death records with the group, looking for reasons why happened and maybe reasons that can help us point to prevention. So but there's still more to come.
More to come. All right.
Can I ask a question about the review? Is there a specific population you're reviewing or all deaths?
This review is Child Fatality Review Board. And it's in coordination with a county agency that provides information from social services, from funeral homes, the office of the medical examiner. The board itself, the board is comprised of different organizations within the county and some nonprofits. It's protected data, it's very delicate data, it's very hard to review these cases because of the content. So there is quite a process requiring people to be very conscious about privacy and things like that.
And you have a consistent board, consistent set of members. You said they come from agencies that are
Yes.
stakeholders.
Yeah.
Good.
I'm very experienced in doing this. They also have experience with the actual cases because they have provider services to some of the families, so they're aware of that. So, but the group is always there about, I should say about between 7 members all the time, but it can be as maybe 10 members. And luckily they invited us.
It would make sense that you're part of it, the
Yes.
board.
I love it.
Yeah, I'm glad you're part of it.
Thank you.
And I actually have a question about that because you mentioned about child review board fatality, because I'm hearing that you're seeing a higher rate of sudden infant death syndrome in specific counties, in specific area of Delaware County. So is that part of that review board?
Yes.
Okay.
In addition to that, we get the actual case investigations of every death from the medical examiner's offices, about 14 pages of details with incredible data, but very, very, very moving stories about what actually happened to the family. In addition, they provide services, the medical examiner's office, to the families so they can manage the loss of the baby or the infant or the child.
And, maybe then in another meeting, we could talk about what we're seeing with sudden infant death syndrome, just because I'm hearing that we're seeing a lot increase in Chester City. So I would love to look at the data and the cost of that.
Yes, of course. Gladly.
That our next meeting in December, personal health is on deck and that ties in really well. We can make a portion of that about that problem and the outreach and prevention work that's being done around that. Perfect. Yeah, this is the richness of data, right? When you can see things, it makes you want to do more and it really is powerful. This is one more example I just put in here. It's related, if you remember that we did that countywide mailing of drug disposal pouches.
Yes.
We also then purchased our own supply of them to give away at community events. And so we have 5,000 of them. And this is showing how many we've given away so far. So we'll be able to see where and how we give them.
We mail some to John Oliver.
Yeah, he wasn't a really big fan of us. But, there's portions of that we understand what he was getting at, but I do think he really missed the boat on the prevention harm reduction goals and that we achieved with that.
I do want to share that I use mine.
But I'm thrilled to hear that. I'm thrilled to hear that. Right. I think, we started showing you the dashboard, but I'm gonna go end on that. I think the thing that we haven't built into yet, but that we can, is you could have multiple plans that then interrelate. So we could build in the Board of Health strategic plan, for example, could be built into this. We could also bring in our community health improvement plan and the program plan. All three of those, the big guiding strategic efforts that we have, can all be built in and talk to each other through the system. When we get really good at this, which is coming, beginners. But again, the dashboarding part of this is also really interesting, and I'll just pull that up before we leave, and it gives you a chance to see across all the operating units, how are we doing on the different program plan elements? What's up to date? One thing that kind of forces us all to be honest about keeping information current is the system will generate emails, reminders that you need to update things either on a monthly or quarterly basis. So, and that's showing how are we doing on the updating, and it's always, there's always pluses and minuses with the abilities to keep systems updated, but it can tell you what's at risk. You can search by which program, by which element, and divide out by, again, operating unit.
And who accesses it now? Is it the whole Department of Health or?
We have done a subset of the department. It's folks that have data to contribute, definitely all the management team, and then divisions have identified some staff underneath them that have data that they directly sense for them. So. Any other questions? Okay, thank you. Great. I'm gonna stop sharing.
The next, I don't know if you want to take over, Rosemary. The next agenda item is the epidemiology update.
I think you don't find Lily because we're.
Okay. Well, again, I have to give all the credit here to Victor
And the team,
and the team, the EPI team. Correct. They worked hard on this. And
yes.
Rose, this is like your request to kind of have some EPI data part of our meetings going forward. So we hope that this is helpful. So part of this is just that we all know this. COVID-19 is increasing significantly in those age groups listed there. We absolutely are seeing this in cases in emergency room visits and in wastewater. All the data is consistent that we have high circulating COVID-19 right now. Some of the other highlights that the team wanted to point out was we are higher, statistically significantly higher in aseptic meningitis and Candida auris cases over the last 4 weeks compared to the similar forward periods over the last 10 years. This excludes some of those other conditions listed out there. One other epi finding, and we'll have some charts and maps from this statewide report came out, the childhood bed surveillance report. I know it's of high interest to the board. I'll show some of the updated information for Delaware County there for both testing rates and for elevated blood levels. There was a little bit there about Eastern equine encephalitis. We aren't seeing any here in PA in 2024. There was one case nearby New Jersey. And that was you asked earlier about West Nile virus and how many cases that we have. That's what 195 from 33 reporting states and less than 5 in our virus. We are seeing some MPOX. They all have what we've been able to identify as travel related risk factors. Rose had asked me a question about the listeriosis foodborne contamination concern, where there had been quite a number of people across the country hospitalized and some deaths. Unfortunately, there were 2 cases in Pennsylvania that are linked as part of this outbreak, but none of them are in Delaware.
Laura, are the Candida auris cases nursing home spread, hospital spread? What?
And nursing homes and rehab, right? For the most part. Yeah.
At the nursing homes, are you giving them technical assistance on the infectious disease? Yeah.
Yes, you're a HA coordinator.
Healthcare acquired infections nurse coordinator. just included a couple graphics of the most recent wastewater monitoring data that we have. The top one is COVID-19. The bottom one is norovirus. So you can see that, it's circulating. This is publicly available data on the wastewater scan site, so anyone can, who wants to see what the latest thing is showing in our. Victor's team also pulled together this table, which is some of the important diseases that we've been finding, a lot of the STI illnesses and how those compared to last year. You can see for tuberculosis, we are 5 cases. Is that 5 cases individually higher? Or is that a rate? That's case, right?
The difference from the same week period from last year is about 5 more this year.
Cases, those are
Cases,
not a rate.
yes.
Chlamydia cases are down compared to the similar period last year. Syphilis, secondary syphilis is a little bit up. Gonorrhea is up. Pertussis, we talked about this the last time. We have some specific slides about that coming up next, but we definitely had a big year for whooping cough. Hep B chronic is down, as is Hep A and D. Flu A and B are way down.
It's interesting to see the age of the pertussis. Is it the older, younger?
High school students, the
High
vast
school.
majority, high school students.
Yeah.
That's always.
And I knew that
Yeah.
this was gonna be during this for more, and so did Victor. So, we definitely wanted to highlight those latest PON that came out from the state health department. We're trying to get the word out with the local medical society, others. I mean, this was a recommendation going back to last year as well, but it wasn't always implemented. And we really want to stress that, if there's a high index of suspicion, providers should start antibiotics even before they get the positive. If it's a family member and they've been exposed, we just really is.
Were the high schoolers, they vaccinated like that?
Let's keep going. Almost all of them.
Really?
Yeah.
Because I know it's required, yeah, so I was, yeah.
And the same thing is happening in every other county in Pennsylvania and every other state in the United States. And around the world, the same problem, the cyclical increases of pertussis up and down.
We're about 4 times higher this week compared to the last nationally. But we did see some decreases in pertussis circulating during the pandemic. So there was all the precautions there did reduce, but now we're right back up and then some. So here's I love this graph that you made. You can really see the trend information. For Delaware in blue, the state of Pennsylvania in orange, and Victor identified almost every year we've been higher than statewide rates, and except for one, I think, 2017. So
I wonder why that is. Why is Delaware County higher than the average of the state?
Well, that's a very difficult question to answer. There are so many factors. One can only speculate. So there are a number of reasons. I don't really have the right answer. No one has the right answer. Even the Pennsylvania Department of Health epidemiology physicians, they don't have the answer to that question.
this is a consistency in the Southeast region, right? It's not just Delaware County as an outlier. There's something about our region and the rates here.
Did you say that these patients have been vaccinated?
Yes. Yes.
But have they been vaccinated with their childhood, but have not had,
Yes.
have they had boosters?
They weren't boosted.
They weren't boosted.
Oh, okay.
Vaccination.
Okay. So they didn't get like at 11 to 12, the Tdap.
Yeah.
They didn't get the 11,
I
12.
think we thought that most of the cases were fully vaccinated at their age.
Even at 11, okay.
And thanks to the team from Stephanie's shop, because they ask many questions when they call to investigate. And the mothers, the parents provide the information within the whole context of the pain that they're going through because of what's happening. So, but we get good information. Sometimes we don't get information and they handle the phone.
That's interesting.
This gives you a time scale both by month and by week, showing this year what it was like January to August of the cases that are coming in.
For the decreases in the, some of the STIs. But I know that it's not like a formal study, but do you suspect that any of the efforts of the health department may be responsible for some of the decreases? Like,
I don't think we can take credit. Can we have like?
I'm totally taking credit. I do think our presence helps a lot, you know, with having more access to testing and treatment. While I can't really confirm that it's what we're doing, I think it's part of it, so.
Great answer.
Yeah.
It is a contributing factor, definitely.
Yes.
How was contact tracing handled prior to the health department? Would the state do it?
State of it.
Well-
And did they do it as effectively as we can?
Would they call it formally contact tracing or would they just do disease investigation, right?
It's disease investigation more so.
That's what it is, a disease investigation, but they pretty much ask questions about partners. And very intensive questions. It is not like, once they identify a partner, they call the other partner, but they ask, please identify your partners and let them know about this so they can get tested and treated. So I think that is the extent of the contact tracing.
The state does.
No,
Or they
No,
do.
we do.
we do.
We do it here. Yeah. Or,
Your
yeah.
question about what's different about,
Yeah.
we took it on and I think we'd have to give that a little bit of analysis. And I think we are able to do more. We have,
Well, I think just having, you know, a little bit more, I'll say manpower, we have more opportunity and more, reach with making those connections
More expeditiously.
more expeditiously. And not only that, what we
And that's important. That's important because they may have other contacts in the meantime.
Yeah, and what we're doing that the state did not do when they were here is we're actually going to homes when we can't reach them by phone and knocking on the doors, looking in communities, looking on social media, looking to see if we can contact these people when they're not reachable by phone. So we're making a lot of efforts to reach out to them.
Seems like a meaningful contribution.
And you're providing treatment immediately.
Yeah.
You know, I'm not sure if the state does that when they're doing those calls and, you know, they have to
Most of
get.
their stuff is by phone,
Yeah.
So we're treating
under regional
expeditiously.
office.
So I think you should take credit.
Yeah, I'm taking credit, right?
Good question. Anything else? I think we've gotten to the point where we're just highlighting some of the blood lead data that you can see, Delaware County. We had some great testing rates. I mean, this is one of these areas, can we take credit? I think a lot of work was done by the coalition and then the health department continued it to increase testing. But we are at one of the higher rates of testing by county. You can see we're actually in the green, so that's good. It's good to do. We still want to do more.
Is this one testing or two testing by 23?
This is the number of percentage of children tested months for blood. I just had this meeting with the Department of Health, so.
Okay.
So this is the graph that I think it is the children that have tested positive who are confirmed tests.
Oh, they're tested positive.
Well, this is, you're
No,
doing the
no,
number
this is
of
just
tests.
pure testing. The
just
next one is
tested.
positive.
Yeah.
Positive is next. So I
Yeah.
think this is a test in that age group. I don't think it's a double, confirmed. If it's a capillary, is that what you're referring to?
No, usually by 2, you would need 2, like
2
9
tests.
months and then 2 years. So I'm just curious, are you counting 2 or just 1?
I have to go back to the
This is
source.
third thing, percentage of capillary by dividing the number of children 0 to 20 months tested in the county by 2019. Estimate of the number of children aged 0 to 23 months residing in the county.
I feel like it's a single test.
Probably, you can say 2.
Yeah,
One test by 23,
and then the second one.
and so this is the confirmed, like you were just saying, either to
Yeah.
confirm capillary within the 12 weeks or a single venous that's elevated by county.
Are you looking at 3 or 5 as elevated?
This is the 3.5.
This is the first year
3.5.
that they had the 3.5
Okay.
micrograms per
Okay.
deciliter. And so the numbers are higher in comparison to the last year's
Yeah.
report, but it's also a lower number.
Lower threshold, yeah.
Yeah, it's a lower. test.
And I'm sorry, this is a number and percentage? This is just the
They
number
have
of
the
positive.
Percentage is the color and then the number is the circle.
Okay. Okay. So we've done more testing and we have more positive tests.
Yes.
Well, it could be more positive because of if they dropped it from 5 to 3.5.
Sure.
Yeah, I mean,
Change the threshold.
yeah.
So just as a comparison, and I don't know if you have this slide, so in Pennsylvania, in last year's report, confirmed and unconfirmed was, which is the unconfirmed is that 12-week thing, so we still kind of count that, was 8,000, and this year it's 12,000.
We can do that kind of analysis maybe next time, because that was one of the things that when we did our analysis, and at least our first, health equity report, we did use 3.5 even from the get-go, so we can.
Yeah, and the state had been, the reports are 2 years, this is the 2022 report, so we have more real-time data.
May I ask a question?
Usually we ask it for at the end.
It's just why you had the slide up, that was my concern.
Sure, go ahead.
I just was wondering if you were able to make any conclusions of what would be contributing factors in the counties that are very red. Or that are red.
So there are, most of the red counties are rural populations, and so most of the rural populations do not have county health departments. And oftentimes rural populations, in Pennsylvania, I think the testing, they have a much lower rate of having the children tested per urban populations.
But I thought these were confirmed elevated blood levels, so those means they have tested.
They have tests, so they have both issues happening in the rural communities because oftentimes the age of the houses combined with the lack of access to testing, the kids are getting tested later. And so they're tending to get higher tests because they're actually having symptoms. And so the percentage of tests is higher.
Thank you.
That was it for the epi.
And I'm sorry if I jumped in there, but it just.
You're passionate.
Yeah, so.
That is my life.
So, thank you.
Yes.
I'm gonna turn ahead. Environmental health already jumped up to speak.
Yeah, which one do I do? You gonna do it for me?
I'll show you.
Good evening, everybody. Thank you for having me. I always look forward to sharing any kind of information on environmental health. I have a great team. They're amazing. They've done a lot of amazing work the last couple of years, so I'm happy to share information. Now, I'll just give a little disclaimer. I'm not exactly sure what you all were looking for, so I only took a few topics. And going forward, if there's anything you ever want to know about environmental health, you just shoot me an email and you know, I'll put together whatever you like. I don't know which one to look at here. So tonight I'll just talk a little bit about two specific topics, basically what's new in 2024. One is the liquid waste hauler program. And secondly, I just want to talk a little bit about continuous quality improvement of the programs that we have implemented over the last couple of years. First, we'll talk about the liquid waste hauler program. So that's new this year. I don't know where, I think I went backwards here. Okay, so July 1st, we implemented that program. Oops. And the liquid waste hauler program basically is it has two parts, two components, license and inspection. And we are licensing and inspecting the trucks that haul human waste throughout the county. So through the roads, you know, going to pick up from porta potties, going to drop off, they'll chlorate and empty their trucks. So it's a program that's also run in Montgomery County and Chester County as well. So this was a fun program to kind of get up and running, believe it or not. We have two amazing sewage enforcement officers who worked, you know, so hard with our EH management to get this up and running. And it was super successful right off the bat. So the inspection basically is a yearly license. You know, we learned from last couple years of putting these programs together pretty quickly. So we were able to do this program. We were able to plan it really well. So we felt like the implementation went off pretty smoothly. So we communicated really early. We got in touch with the trucks. We're gonna try to partner with Delcora to see how we can work together. We trained all of our staff ahead of time, which was really, really nice. That worked out really well, especially with our software system. We had to add on a package for that, so we got to train everybody for that. And then the inspection. We're hearing a lot of positive feedback from the inspections. I think as of July, I think we have licensed around 200 liquid waste haulers. And then we were averaging about 6 or 7 a day.
People doing this for the most part, right?
So we have 2 SEOs running this, but there was a lot of people, a lot of hands in the pot creating this program. So we were thrilled about that. We held our first event right in the Baldwin parking lot. It went really well. The other, I don't know if this is our updated slide, but I'm gonna roll with it. So the other piece we were gonna talk about today was continuous quality improvement and just staff development as part of that. You know, we had for the last 3 years have, you know, had our foot on the gas, getting all of these foundation programs up and running. We just thought it was really time to kind of just release the gas a little bit and start to look at our programs. You know, see if we're providing, you know, quality service. So we kind of skipped that early on just because of the, you know, the momentum that we had in the division and in the department as a whole. So just a couple things on that. So, you know, we're formalizing all of our meetings. We're formalizing our work sessions, our training sessions, our team building sessions. So they're all getting planned, you know, early in the year, and we're staying on that schedule. And, you know, we're just kind of hoping to, you know, empower staff, you know, foster the culture, enhance trust, you know, through, you know, between management and staff and throughout the division. So we're super excited about this. We've already had a couple team building sessions that went really well. That's a positive feedback. One key thing in here is the standardization, which is a really big piece, and that has to kind of come, that's in partnership with Pennsylvania Department of Agriculture. So basically, the goal is from PDA down is to have the standardized inspection process. We're not there yet, but we're putting things in place in our division so we can kind of move forward with that. The other piece of this kind of quality, continuous quality improvement is just SOP development. You know, we didn't have a lot in the beginning. And again, we're just really kind of looking at our programs, looking at our processes, you know, gathering data. You know, it's in line with the, you know, the overall strategic plan with Laura, you know, really focusing on mission, vision, and values. We're focusing this year on collecting as much data as we can. We just didn't have a whole lot of data. So we're looking to expand our inspection management system, which is our software system. We're looking to update our existing protocols and processes, and really just kind of refining that. 2 things we are, I guess these inspection report audit and the inspection audit are 2 of the things we really started a couple months ago that is starting to bring us in data. And, you know, basically we're having people look at our inspection reports, going through, you know, what are we seeing? How can we start to track what we're seeing in these inspections? And then as far as the inspection audit is concerned, our management is involved in that. They're making follow-up calls to the facilities, follow-up calls to the managers that are on site. And just kind of getting an overall view of, what we are doing, what our EHS are doing, what our staff is doing out there. It's going to help with, training needs, workforce development, and with that standardization. This, I think you may have seen this in one of the early reports. You know, I thought this was a really good start for us. We implemented this early on. So early on, we had, I think, somewhere around 12 zones where we sent out our staff to, do our environmental health work. We noticed really early on that we weren't providing, consistent service. So we wanted to set up this region map so we can kind of implement everything that I just talked about in the previous slides, getting, that consistency of service piece. So we decided to change we got rid of the 12 zones, which was by municipality, and we broke it up into 3 regions. So you can see it, region 1 is in blue, region 2 is green, region 3. So we're providing the services that we provide as an environmental health division. We're just how we're providing that service is based on, the site. So this is just region 1. This is just to give you an overview, of each region. So that's region 1, region 2, and region 3. So this is working out really well for us. And then the gray area is the area of the injunction. We are not providing service there. I just threw I can't really see this that well. We threw a little bit of data in here for you. So, and this is by region. So the top left is number of inspections. You can see how it was pretty much distributed fairly evenly. This is where we're starting to see a difference in our staff and how we're kind of maturing. So you'll see the dark blue is our routine inspections. The light blue are our follow-ups. So we really, those follow-ups came down a lot over the last year. We needed to be. It just means that, some of the training that we're giving the staff is working. We're consistent and we're a little more thorough in those routine inspections, which is really should, not require us to go out for those follow-ups. So we're hopefully see a little bit of a decline in those even further. And then the top right, number of facilities by region, fairly, we have these denser areas in the county and these more not so dense areas. So there's a little bit of fluctuation, but you can see it's fairly consistent across. And then septic and well permits. That is not by region. That's one it's pretty much sporadic throughout, but just want to give you an idea of what we're doing as far as septic and well permits. But a little bit more, and I think I might have done this last year. So we can, if we skip down to the bottom group, just like the top 3 violations in each region, you see in region 1. And I talked a little bit about this last year. So let's look at region 1. The first one is insects, rodents, animals not present. Doesn't mean that there's, they have an infestation there. Each violation also has kind of subcategories. So this might mean more so, they consistently found rodent droppings, throughout the kitchen or in storage areas. Or maybe the facility did not have regular pest control, which is, which we require. Region 2, food storage containers not labeled. So these are all of the risk factors that ultimately may lead to foodborne illness outbreak. And then a little bit here. So just to talk about the risk factors again, just as a reminder. So on the bottom, you'll see 1 through 29. So our report is basically divided up into 2. So we have high risk on the top, lower risk on the bottom. So I basically took a look at the top part of the report, the higher risk factors, and those are the ones that are ultimately, could lead to a foodborne illness outbreak. So if you could just see, looks like 10, 23, and 1 are the highest risk factors. And this is across the region. And, 10 is hand washing. Which, subcategories could be they didn't have paper towels, they didn't have soap, or we didn't see somebody wash their hands during the inspection when they changed duties. 23 would be date labeling, so it's consistent with the previous slide. It's a tedious thing, but they're required to label the food that they prepared because it's, it has a limited shelf life. And then I think one is licensing, and the person in charge is, knowledgeable enough to run the facility. And that's our team. And then I must say, and talk a little bit about, since Rachel is here, one of the other new things we started this year, which I'm super proud of, was through the MDC grant. And last year, we all but begged the DEP to let us add this outreach position, which, is in line with their mission at DEP, teaching people about West Nile virus, teaching people about, mosquitoes, how to prevent mosquito bites. So we asked to get this outreach position written into the grant, and they actually did write it into the grant this year, and all the counties got to add this outreach technician. So we're super excited about it. And Rachel was actually our outreach technician, so I'm glad she's here tonight. Education is the foundation of what we do, in the health department, and, especially, we push that in environmental health. So, Rachel conducted, you're in the teens, I don't know how many, outreach events, all about, West Nile virus, how to prevent mosquito bites, what people can do around their homes, to prevent mosquitoes. And, we had a great time with that this year. It was, lots of positive feedback from all the places that we went. I got to go see Rachel do it, and we're really hoping to even expand that next year. I thought for year one, Rachel did a fantastic job, so.
It's that crazy piece of trying to put yourself out of business in public health, right? If you're doing a good job of preventing things from happening, that's exactly what that is. And it's really hard to measure what you prevented, but we know that we had an impact with that breadth of outreach.
That's part of my amazing team.
Yeah.
And that's it.
Maria, I do have a question. By the way, I enjoy reading that Monday report from the Delco Time. I read it every Monday. So I really enjoy reading it and kind of know what restaurant to go to and not go to. Just curious, were there any major foodborne illnesses that you have seen in this year at this, that you can report out?
As far as positive cases, we haven't had any investigations this year. I think we had one last year. And I think, Victor, can you agree with that as well?
Absolutely,
Yeah.
not on wood.
Yeah, knock on wood. We have seen so many, and if that's something you all are interested in, we can actually pull that information. We actually track that now through IMS, our software system. So many complaints. And although they weren't confirmed cases of foodborne illness outbreak, we have delivered so much reteaching because people got sick. They might not have gone to the hospital, but they had symptoms, from whatever they ate or whatever, they took in by mouth when they visited a restaurant. So we do see a large amount of complaints, so.
Ray, what's your approach when CDC reports a listeria outbreak or boar's head meat? Do you send out a notice to retailers, food retailers, or do you do inspections to make sure that lots of deli meats are not part of the recall? What's your approach?
Yeah, we actually, this is a huge thing. I'm glad you actually asked that question. We do work with the state. We work with them very closely. We've established an excellent relationship with them. They will actually come to us for exactly what you described. If we can get out there, we typically send our folks out. If it's early enough in the day, we'll send them out that same day, if not the next day. We're looking for the product. There's a special form that we will fill out. We actually just did one. I can't remember which one it is. Do you remember which one it was, Rachel?
The shrooms gummies.
The shrooms gummies, yeah. So it was a big deal. The gummies that they're selling now look just like kids' candy. So, PDA put out an alert to us. They asked if we could help. We sent out staff, and there's a form that you have to fill out, and everything goes back up to the state. We sent out our staff. We gave them the training first. We sent them out. They actually found it, took pictures of it, completed the forms. It depends on what the case is. In this particular case, we'll encourage the facility owner to take it off the shelves. And we won't leave until they take it off the shelves. So and most of the time they don't throw it away, they'll send it back to the supplier and do whatever they can get, but it's off the shelves, it's out of the public view. The form is completed and everything is sent up to the, up to the state. So we do work with them. We might not be the one, leading it and spearheading it, but work very closely with them, yeah.
Very good job. Um, So, we're ready for the public comment. Go ahead.
Just under new business, you announced the executive sessions. Yeah. Okay. And, the one other thing I did want to recognize is Oni, did you want to announce the big announcement for your
gosh,
client?
no. We're opening up a new clinic in Darby, October 2nd. And so we're having an opening on September 27th, Friday, for uninsured residents of Delaware County and Philadelphia County.
Yeah, sorry, I think you know, very proud. It's a good way to show that there's a partnership.
Yeah, I told Laura already.
Yeah.
I think they have people.
Yeah, so it's a great way to, and,
We're definitely sharing the word with our wellness line and other staff in the department are aware, so we can refer patients. It's gonna be really, really great.
Can I ask you about that? What's the staffing for that clinic?
So we have two medical doctors. One is a general internist, the other is a OBGYN, and one nurse practitioner, and a nurse, RN and what's the other one? CRNP. So two nurses and two medical doctors.
That's great. And the hours, if you could share that?
So right now, we're open on Wednesdays and Saturdays. Saturdays because the
Saturdays.
the clients requested that.
That's great.
But hopefully moving to more full-time by towards November.
That's great.
big accomplishment.
Yeah, it's been a
And it's,
favor of love.
and it's needed in this area, especially with the closure of Delaware County.
Yeah.
So.
Exactly.
And one little thing, I did one, this is from Laura. Laura has been amazing with all the changes and stuff this week.
I do.
Thank you for everything.
Thank you for all your work. Nothing else.
I think it's been a sunflower on my computer, isn't it?
Oh, yeah.
Yeah. That's great.
So that was just all additions to my chair report. Thank you.
Thank you. So we're ready for public comment at this time. Did you want John to give instructions?
I think we all know.
Okay.
Hello, Harris Coker, Concord Township. Yes, I'm sure you're all aware that the America 250 is coming up in 26. But this month, as of September 5th, was when the First Continental Congress assembled in Philadelphia, and they met through October 26th. And that was the beginning of the groundwork of the things that gave birth to the freest government that had ever been on the face of the earth. And I'm grateful to live, never dreamed I would ever live this close to Philadelphia when my husband came to work as a helicopter test pilot at Boeing about almost 40 years ago. But anyway, I've really enjoyed living here and been in Delaware County the whole time. In watching the things that have unfolded with COVID-19, and then the recent concerns of the matters coming out of the WHO operations and so forth, I think it's a good time to remember as public servants, and I appreciate your service, I do believe you have a genuine interest in the health of the public and your fellow citizens, to remember our obligation to uphold, support, uphold, and defend our Bill of Rights. And I know that can be a fine line sometimes in public health matters, but I ask you to very conscientiously and earnestly consider it. I have been considering the various ones in county government here in Delaware County who have taken an oath of office, and I've been surprised to discover that many have not. There are some who hold that the law does not require it to be as broadly as I think it should be, but the law states, in addition to any oath or affirmation required by any other act of assembly, all county officers their deputies, assistants, and clerks shall, before entering on their duties or their respective offices or employment, take and subscribe the following oath. I do solemnly swear and so forth. And this is an oath that's lengthy beyond what the customary oath that we're recognize when a judge is sworn into office and so forth. In January 10th, 1963, it was read into the congressional record. It's located in the appendix, pages A 34 to 35. Someone read in the 45 goals of the communists they had published them. Number 13 was to remove in the United States the obligation to take a loyalty oath. And I'm not sure whether this just applies to the director who's departed, but I certainly will be the new director coming on board. Thank you very much.
Thank you.
Thank you. Are there any more public comments at this time? I don't see any, call for adjournment of this meeting today. Thank you, everybody. Thank you.